medicine applications and the whole process essentially. I myself am almost a doctor. Once the I's are dotted and the T's are crossed, finished my exams yesterday. So about to be a doctor, and I'll still continue working the foreseeable future, helping with their admissions. So medicine and dentistry in the UK. I guess one of the reasons students have to think is why study it? It's not necessarily a degree like any other degree, it's a job. And so I guess something students have to come to grips with is why they're doing it. And often it's best if the student can come to those decisions kind of freely rather than being pressured into it. And those students that do that tend to have the best outcomes in terms of applications and dentistry, of course. If I keep saying medicine without saying dentistry, just pretend I'm saying dentistry as well. They're essentially the same process, but I'm so used to doing medicine once, although, so just forgive me for that. So there's 4 stages of the application process. The first one is the personal statement and experience. Now that's a very long stage. The writing of the personal statement is not, but the doing stuff to go in it is. So it's very important students start as early as possible with the kind of knowledge building process and getting work experience. Generally speaking, it's advisable to have at least 2 weeks of healthcare related work experience. You don't necessarily need more than that, and it doesn't necessarily have to be a fancy brain surgeon. Often the best work experience is with a family doctor or GP, because that's what most people end up doing. On top of that, it's good for students to have volunteering. Universities love that. And then beyond that, it's about wider reading, building general subject knowledge, and that's something leading education do very well. What I will add to this is that for the current application cycle for 2024 entry, they're still doing personal statements. The year after, they're removing them. When I say removing them, they're now just distilling it down into 5 shorter questions. And that's basically so students now have a bit more guidance of what to say and make things fairer. It's not going anywhere, it's just changing form, but it's something to be aware of. The next stage is choosing a medical school. I'm going to talk about that a bit more as we go forward, medical/dental school. Then we've got the admissions exams, the UCAT and or the BMAT. Some people end up doing both. Some people just do the UCAT. It's a bit less common to just do the BMAT because it's for specific universities and it's less common. I'm going to talk about that more. All that going well, hopefully an interview, and then your offer and your new life as a medical student, dental student, doctor, dentist. So there's 3 types of course in the UK. There's the traditional course, which is mainly done by Cambridge and Oxford. Supposedly UCL do it as well. I think Cambridge and Oxford do it better, but they all do it. What that is essentially 3 core years of hardcore science. You basically do a science degree for the first 3 years. And in Cambridge, I was doing basically the same modules as my friends doing the natural sciences course. There was no difference in it. It was identical. We had a few more modules, but beyond that, it was pretty much the same. And you do not feel like a doctor at all when you don't touch a patient for 3 years. The last 3 years, you go forward and then you go into the hospitals and you start feeling like a doctor, and it's great fun. The downsides is if you really want to get stuck in, be a doctor, you can't for 3 years. I guess the upside is you get to experience being a bit more of a normal student for 3 years before maturing and then entering the hospital. And, I know I wasn't mature enough at 18 to be in the hospital with real patients, and I don't think that many people are. Now, the integrated course is done by the dental schools. So traditional courses aren't done by any dental schools, but integrated is the main one. It's kind of the recommended course by the GMC, the General Medical Council. In this, you can kind of view it as a crossover. So you have increasing amounts of clinical exposure as you go through the course and decreasing amounts of lectures and lab time and study. Essentially, side by side, you'll be learning as well as going to the hospital. The downside is you get stuck in quite early on. Some people may view that as a plus side. And I guess one of the other ups is you need to get experience being a doctor really early on. The final course type is problem-based learning. Now, this is done by the University of Manchester specifically, but actually a few other courses do it. Now, it's a bit of a weird one. I've got a slide on this coming next, actually. But I just want to talk about intercalation. If you don't know what intercalation is, now medical school lasts for 5 to 6 years in the UK. It's not 5 to 6 years because some people take 6 years. It's 5 to 6 years because there's the option of an extra year where you can do an additional degree and it fully counts as a degree. Now, it's not offered by every medical school, so that's something to consider. And also, some medical schools are competitive to get into it. So Oxford and Cambridge, everyone does it. It's compulsory in UCL, it's part of the traditional course. At other medical schools, it might be the top 30%. So it's something to consider when selecting a medical school if it's something that might interest you. Again, at Oxford and Cambridge, you can study any subject. For your integration, you can do maths if you can prove you're good enough. You could do history, you could do law. Other medical schools are a bit more limited as to what you can do. So this is problem-based learning. So essentially, it's done by most universities, but to differing extents. It's essentially lots of small group learnings. You're presented with a problem or case, and you kind of need to decide the outcomes and what you need to do to answer the question. You'll often get concurrent hospital exposure in that field. So if it's chest pain, you might be on a heart ward or a lung ward, and you'll go away, gather the information, and come back and discuss. And it's a much more independent way of doing things. Some people really like the idea of it. I wasn't as mad on it, but there are pros and cons to everything. So those are the 3 courses. Now, these are the location of all the medical schools in the UK. I don't know why, but Manchester is missing, and I'm yet to find one which includes it, but Manchester has a medical school, and that makes me suspicious some others are missing, but I guess not everyone's going to remember all of these. So this is a snapshot, let's call it, of all the medical schools. Location's really important. You're there for 5 to 6 years, so always encourage students to really like where they're applying and look into it in terms of the university and the city. The rankings do not matter. They change every year. You come out with an identical medical degree and it's got no foundational basis at all in how good the degree is and how happy students are. It's much more of an individual personalised decision. I guess the big divider is, do you want to be in England, Wales, Scotland or Northern Ireland? And within England, do you want to be in London or outside of London? I think those are the biggest dividers in terms of location. For dentistry, there's the location of the dental schools. This one is all-encompassing. This is all the dental schools. I'll just draw brief attention to the different course types. So 5-year undergraduate course is your standard. Again, you can intercalate, so make it 6 years at various unis, one to be looked into. The 4-year graduate course you do, and this applies for medicine as well, if you've already got a prior degree. That's offered by some places, but not everywhere. Some have a 5 and 6-year undergraduate course, so that means you can intercalate. Some have a 3, 4 and 5 course, and some you have a 5-year undergraduate. So it's all very varied, and there's lots of combinations, and it's about deciding what you want to do. Now, Oxford v Cambridge, you can't do dentistry either. So if you want to be a dentist, that's a very quick and easy decision for you. Beyond that, Oxford and Cambridge aren't too different other than the logos. This course structure is essentially identical. The big differences are, at Cambridge, you can do something called full body dissection, which is really cool. In your first year to learn anatomy, you get a whole dead body to work through, you and 7 others. Quite overwhelming at the start, but that's how they teach anatomy. They don't offer that at Oxford. I guess another difference, and this is probably the big one, is about the cities themselves. Some people say Oxford is a university within a city. It feels a lot bigger and, busier. Cambridge is a city within a university. It's a lot more calm and tranquil. I preferred that. I believe Matt also, I'm guessing, preferred that. It's much nicer in my opinion. Another big difference is the medical school at Cambridge is not quite double the size, but it's bigger than the Oxford one. That used to mean that there was a higher chance of getting into Cambridge because they had the same number of applications. Not sure what's happened, but it's evened out now, and Cambridge just get more applications, so it's equally hard getting into both. The big difference is Oxford don't interview as many people as Cambridge does. So if you're someone who's not as strong on paper, Cambridge is probably much more worth considering. Again, from my perspective, I really wanted to be interviewed. I didn't want to be rejected without them even looking at me. And so I really, really wanted them to interview me, and that's what clinched Cambridge for me. In terms of admissions, you get 4 choices for medicine. You get 5 slots on UCAT, and only 4 of those can be medicine. That's because I think they just spend more time looking at the applications, and it just lowers workload. It's got a 9.5% acceptance rate. Now, I will caveat that this is for home students. We're going to talk about international students after. But anyway, it's quite competitive. That 5th option, you can choose to be anything you want. I applied for chemistry at Bristol as my 5th option. It doesn't matter. If you want to do it, you can do it. You also can't apply to Oxford and Cambridge, just Oxford or Cambridge. Next, you do the personal statement. Again, it's a 4,000 character sales pitch for you. Going to come on to what should be included in that after. And you have to do the admissions exams. And that's basically the medicine admissions process. The fifth choice, as I said, can be anything. Lots choose biomedical sciences. It really, really doesn't matter. It's up to you. And you don't have to put anything if you don't want to. So work experience and volunteering. This is stuff that would build into the personal statement. So I said I recommend 2 weeks minimum. The best thing to do is go to a general practice / family doctor. It doesn't have to be in the UK. That's because over 50% of graduates become a GP. So statistically, you're going to become a GP on paper. And it's the nitty-gritty, less glamorous side of medicine. And that's what they want to see. They want to see that you know that it's not all brain surgery and, cool heart transplants. There's a lot of other stuff that goes on, and they want you to know that that's important too. You can do 1 week as another, and if you've got an uncle and auntie who's a top brain surgeon in New York, and they do a specific type of surgery, and it's cool work experience to brag about to your friends, all well and good doing that, but it's not realistic because you're not going to become a brain surgeon, most likely. So they like seeing that you have an idea of what it's like in a hospital, in a general ward, and a GP. Volunteering can be medical or unrelated. I mean, I volunteered in a care home. People volunteer in soup kitchens. They might teach local school children. It really doesn't matter, but they like seeing some volunteering. Lots of hospitals will have opportunities. They'll have volunteering pages. So it's a good place to look. Yeah, I mean, they just like seeing it seem nice and can commit to something. That's the main thing. In terms of professional career, you are guaranteed progression into a career of your choice. In after medical school or dental school, you are guaranteed to progress. Okay. What that starts with in dentistry, you do 1 year as a junior dentist. I don't even know what they call it, but I've got friends doing it. Some sort of one year NHS job, and you work in a practice. In medicine, you do 2 years as a foundation doctor. Within that, you rotate around 6 specialties over 2 years, 4 months each specialty, and get wider experience. After that, and this applies to dentists, you apply to higher specialty training and you become what's called a registrar. And then the pathway to becoming a fully qualified consultant can be 8 to 10 years following that. So it's a long, long slog, but you are paid throughout. If you want to be a GP, family doctor, it's only 3 years of further training after being a junior doctor. So it's a bit shorter. If people want to earn lots of money, GP is the best one because they make lots of money and they reach their peak earnings faster. And it's a very nice lifestyle. So I can see why people do it. But that's how it works in the UK. Unlike other countries, you don't go straight into specialty training. And also the specialty training lasts a lot longer here. So I worked in Spain for a bit, and they take 4 years to become fully qualified specialists, and they don't do these foundation years. So it is longer in this country. In the personal statement, you generally talk about introductions, so motivations, what made you want to study medicine, supracurricular activities, so reading, any academic extras, competitions, everything like that. Grey zone is kind of where you talk about your work experience, volunteering, were you president of the medical society at your school, did you do this? And then the extracurricular is a bit less important, but it's still needed, is, sports, music, talents, did you, win a debating competition, that kind of stuff. This is an example of my epiphany in my personal statement, my introduction. I'll give everyone 30 seconds to read it. Okay, so I think it's pretty good. I don't know how I managed to come up with that when I was 17, but anyway, wouldn't expect everyone to be as I couldn't write like that now. But anyway, that's an example of an epiphany. These are the things they're looking for on the personal statement. So you don't tell them I've got people skills. You don't tell them I've got leadership potential. You show them I'm committed because I'm grade 8 in the flute. I have people skills because I'm on my school's council. I have leadership potential because I'm the head boy, head girl. Those kind of things, you're showing them that you can do this stuff. I think a really important thing to include, which a lot of people miss, is this passion to learn and teach. That's because as a doctor, you're forever learning, but also you're forever teaching. The way the training works in this country is you're constantly teaching your people that are more junior than you. And so you need to know exactly how to teach. And it's important to showcase that if there's some volunteering at school that means you teach the younger years, do it, because it's such an important skill that they love to see in medicine. Why is that not moving on? There we go. And as I feel like I'm repeating it, but this is everything in the personal statement portfolio. So this is the supracurricular reading. EPQs are amazing. They are gold dust. If the school offers them, do one. And do not do, as I've had discussion with people before, further maths is absolutely useless for applying for medicine. Some medical schools don't even consider it a different subject. They won't even count it. And if you do it, you risk them giving you an offer including it compared to your counterparts getting an easier offer. It's not worth your time. What is worth your time is the EPQ. And if it's between EPQ and further maths, you have to do the EPQ. I put Duke of Edinburgh Award there. I guess it's possibly a bit less relevant for international students. They don't care about the bronze award that I did when I was 15 and I went for a walk for one night, and it's not impressive. If you're doing the gold DofE, it's brilliant. But ultimately, you're actually doing all of the Duke of Edinburgh stuff anyway by doing this. So it's an additional extra, but not necessary. Essentially, you're demonstrating the qualities of a doctor. That is what they want. They want someone who has the qualities listed previously. And keep a log. So it's very easy for students to forget things they've done. I always encourage them to keep a log of activities. Now, this is the University Clinical Aptitude Test, or UCAT. It's used by 30 medical schools. I haven't bothered listing them because I've listed the BMAT ones on the next slide. So everyone that's not listed there is UCAT. It's used by all UK dental schools except Leeds. They use it differently. So Bristol use it 100% pre-interview. Birmingham's about 30% of the weighting pre-interview, and they might look at your GCSEs or other exams. It does vary. You book it yourself. You do it in it's a Pearson centre there in lots of different countries, and you get your result before you apply, which is useful. So if you mess up and you don't get the result you wanted, then you don't apply to the medical schools that need a good one. So you can be very tactical with it. It's split into these 5 sections. I've just got a very quick example, but this is an example of preparation. So you don't need to get overboard. It says up there that the highest scoring candidates said they spent 25 to 30 hours preparing. I suspect people do a bit more than that. But, it's very much one of those tests. Once you're used to the style of questions, it's a bit hard to progress. Obviously, Leading Education do offer brilliant sessions on it that tend to really help the students. But, sometimes students go overboard and want 40 hours of work on it. It's sometimes diminishing returns at that point. It's an example of a maths question. I'll give everyone 10 seconds to have a look. So the answer is A, because gambler's fallacy doesn't affect future outcomes, past events. I won't go over this one. This is really hard, this section. It's the shape section. You have to spot the pattern in set A and set B, and then decide which group the shape belongs to. I've done this PowerPoint to probably thousands of people now, and I'd actually forgotten the answer to this because I made it a while ago. And it got to about February. I did a seminar, and someone knew the answer to this, and it was the first person out of thousands that got it. So it's really hard. Very simple pattern, actually. Set A, the bigger shapes are black. Set B, the bigger shapes are white. But it's very pervasive. I didn't get it. The BMAT, biomedical admissions tests, apparently they're stopping it as well, either next year or the year after. I'm not sure what they're going to replace it with. I imagine it would be something similar. I'm not even sure if it's confirmed it's stopping, but it's certainly rumoured to be. These are the universities that use it. BSMS is Brighton Sussex Medical School, and for the dentists out there, just Leeds use it. Again, different universities use it differently. I would caution doing the BMAT unless you're in love with one of those universities. The only other reason you should really be doing it is if the UCAT doesn't go as well as you want. So either you want to go to one of those, or the UCAT doesn't go as well, because this one you apply, but you do it after you've applied. So if you don't do well in this and you've only put down BMAT ones, that's medicine gone. So it's really important to be tactical. It's obviously an extra exam. People have schoolwork, so it's important to think about this when applying. It's 3 sections: problem solving, which is actually quite fun. GCSE science, it's a bit harder than GCSE, and an essay section. In terms of preparation, there's lots of practice papers. You've got to learn GCSE science again. There's a specification online. And this is where lessons can actually be a bit more helpful. Definitely with the BMAT, I'd advise getting some practice there. And again, practice some wider medical reading for the essay section. I say essay, it's one side of A4 and you have 30 minutes to write it, and you're limited to one side of paper, but still an essay. We'll skip over this because we'll take a while, this question, but it's an example of a problem-solving one. I mean, everyone can read it. Screenshot it or take a picture, whatever you want, if you want to have a crack in your own time. Essentially, it's about forming algebra and converting this into algebra, and the students will learn to do that through practice. I like that question. This is a biology question. Most students get this right. If anyone remembers their school biology, number 4 is false because gametes are haploid cells produced via meiosis, not diploid. But yeah, it depends if you remember that from school. In terms of the essays, these are the essays. This is from my year. It was quite fun. You can either go, so the 4th one at the bottom, it's no longer 4. It's because vets used to have to do this exam. They don't anymore. Number 3 is probably quite relevant because there's junior doctor strikes at the moment, and there were in the year I applied. So it's important to encourage students to stay up to date with that. I did a funky essay. I chose number 2. I wanted to be a bit creative and do something a bit out there, but some people prefer to kind of go for a more factually based one, such as 3. So 2 exams, 34 medical schools. I can't remember how many dental schools there are. Let's say 10 dental schools. How do you decide? So Oxford, Cambridge in general preference. When the exams are set, so do you want to do the UCAT and you do well? Is it even worth doing the BMAT? And if you don't do the BMAT, it cuts you out from those BMAT universities, which makes things easier. And hedging your bets. If you get a good UCAT, apply to a university that needs it because you've got a better chance. Likewise, if you don't get a good UCAT, don't apply there. So I had a student who was amazing. He runs a TikTok. He has done loads of amazing things, raised loads of money for charity. Didn't do well in the UCAT, applied to the wrong universities and didn't get any offers, despite all this amazing stuff, top grades. Second year he applied, did amazingly in the UCAT. Nothing else really changed, but he got 3 offers or 2 offers, I think. So it's really important to be tactical with this applying. And that's, again, where speaking to someone like me does come in useful because I can help students through that process. The interview, there's 2 types, multiple mini interviews or a traditional and panel interview. Traditional panel interview is what you're thinking of. When you have an interview, you go into a room, you sit there, people speak to you. It's done by those universities. Everyone else does a multiple mini interview. They're essentially circuits. So it'll be the same questions as panel, but you've got different interviewers and you go around, say, 8 stations and you speak about the same things. But it's good because you get lots of different first impressions. And if you don't get on with someone the first time, then that's fine. It's all on the same themes. So these are some example questions and these are kind of the skills they test. So motivation, why do you want to be a doctor? Everyone will be asked that. It's important to have a good answer. Again, attraction to the university and course. Why do you like this university? What do you like about it? Role, talk about the NHS, hot topics, so strikes, very important. Students are aware of what's going on. Personal qualities, tell me about a time you made a mistake and how you fixed it. Quite a classic interview question anyway. And then you might have stuff on medical ethics. And a bit of a weird one is you sometimes have a role play station. They get an actor. You have to tell them you've killed their cat or tell them that, they might die. I think that'd be a bit extreme for an interview, but possibly. It's a bit of a weird station to settle into because you're not used to it with actors, but it's important students are aware this could happen. Some traditional ones. Now, these are a bit more Cambridge, Oxfordy. These questions, why do we breathe? There's a new power station, how would you design an experiment? Why might someone have glucose in their urine? And this is applying a lot more of those core scientific concepts that would prepare you for the start of a Cambridge course as opposed to a normal medicine course. So they're a bit more funky and out there and require a different approach. So that's the end of the applications. I just want to show everyone this web page. I should have got it up before. It's a bit scary in terms of international students and admissions. So if we look here, Matt, can you see the screen? Can everyone see the screen? Yeah. So if we look, this is all the institutions, the universities, and this is the home students, these 2 columns, and this is the overseas students. So if we look, for medicine at the University of Birmingham, there's 372 medicine students and 67 medicine students that are at home. They allowed 28 international students and 4 for dentistry. Again, University of Central Lancashire for dentistry, 1 international student for dentistry, that's it, and none for medicine. Although that's a private university, so it's different. Cambridge, 22 people in the whole world are going to get a Cambridge offer that year for medicine. It's pretty bad. And not to make it worse, because of Brexit, EU students now count as overseas students. They used to count as home students. So in my year, there's lots of people from the EU. They were, in the same pool of applicants that I was. Because of Brexit, they've been removed. It's a tragedy because we're losing EU talent. And also tragedy for the rest of the world because now they're in competition with EU students too. So it's probably the worst thing that's happened in a long time to this country. But anyway, it's a shame, but it's very competitive for internationals. So they need to be on their game. So that concludes the presentation there.
I want to say a big thank you to those of you who have attended. Kept it nice and short for you today. And thank you also to Jesse. Huge expertise. I don't know how many students you're working with at the moment, Jesse, but all the students that we have that come through here, and they get this level of insight. It was a whistle-stop tour of kind of what needs to be done and hopefully see the level of expertise you need. And that's where someone like us can help. And again, if you have any students interested in any subject, you know the drill, give us a shout. We can do the online stuff. We've got the summer schools. So if they're not sure they want to study medicine, they can have a taste this year in Oxford University at Wadham College. Welcome them into the UK to have a go. So I think we'll call it a day there. So thank you once again to everyone. And it's lovely to see you all online. And please do send me an email if you have any questions or any follow-up whatsoever. And I will see you all again, hopefully very soon for another webinar on another part of the application process. Thanks all. Bye-bye.